I'm Dr. Valery Nji from Cameroon, a medical doctor at the Bali District Hospital. In my community and hospital working, I found a problem with respect to the level of the management of women in labor, so I thought this would be an opportunity to increase that and improve the quality of care given to these women. The project is entitled Improving Maternal and Neonatal Outcomes in Labor through the use of Intrapartum Care Guidelines. So in our community, most of the practices there are not really evidence-based practice. So I think this is a way of actually bringing this evidence to them to improve their practice, so to improve healthcare of these women. I was trying to increase the compliance of clinicians to the practice of evidence-based healthcare in management of women in labor. I was also trying to improve practices with respect to the use of pathogram in monitoring progress in labor, and also increasing compliance and communication between the midwives and the pregnant women in labor. So from the patient perspective, the patients actually didn't get enough communication from the health workers, especially the midwives, and the patients didn't really think they were being part of the decisions in the healthcare. They were not part of the decision that was taken concerning their health, and the patient felt like they have a right to be part of the decisions and to be informed of the things that have been done to them, especially cultural practices which have been done by the health workers, and the patients didn't actually know about it. When I went back to the hospital, I had to tell them about the workshop which we did here, clinical leadership program, and about the project which was going to implement in the hospital. The patients too, they were very much excited about something new, considering I traveled abroad, and at the end of the program I was bringing changes to the hospital which actually deal with the management of their care, so they were very much enthusiastic about it. At the end of the follow-up, or the follow-up with the patients, and the perspective actually changed, as well as with the workers, the health workers too. A common example for this was the issue of pregnant women, which was actually the use of pathogram, which was not a common practice in labor. So with this, we actually brought in the standard use of pathograms and actually trained them on the use of pathogram with respect to monitoring labor. With that, you can actually know how labor is progressing. You can actually know when there is a distress in labor, and you can know when it is time to take action, like a surgical action with respect to management of the delivery. I think it has actually increased my skills in clinical leadership, increased my skills also in implementation project, as I hope to carry out other implementation projects too. And I look forward to engaging more in this program too. This is a wonderful opportunity being part of this clinical leadership program, and I also want to for carrying out the knowledge learned here to my community. I think I have the skills right now to mentor my colleagues in evidence-based practice.